A very good evening to one and all. Welcome back to the today's session. Today we have our guest speaker, Dr. Dipika Sindha, ma'am. We welcome you, ma'am. Assistant Professor, Department of Homeopathy, Medica, PG, Parul University of Research, Gujarat. We welcome you, ma'am. We welcome all the participants. Today, our topic that will be taken by ma'am is dermatographism treated with individualized homeopathic remedy, a case report. So it is a session is all yours, ma'am. Kindly continue, ma'am. Thank you.
Okay. Good evening, everyone. It is my honor and pleasure to welcome you all for this session. I sincerely thank each one of you for joining us today. I would like to thank the organizer, All India Homeopathic Student and Youth Association, Dr. Arpana Parikh ma'am and Dr. Lavanya ma'am, National General Secretary of the IC team, for inviting me to be a part of such a wonderful event. It is an absolute honor to share my thoughts and experience with the case with such an audience. I'm heartfully thankful. So let us start with our today's session. So I am presenting today a case of a dermatographism, which was treated with the individualized homeopathic approach. And we will look out the first thing, that is what is a dermatographism. So we will first see the few introduction and few things about the dermatographism. What is the dermatographism? So dermatographism is also known as a dermatographism urticaria, is a urticarial eruptions upon the pressure or trauma to the skin. So whenever any kind of a trauma, whenever there will be any kind of a pressure or any kind of a scratching or slightest injury will be there, it will produce the dermatographism. The skin reaction present as a erythematous wheal in the dermis and can have innumerable causes. So dermatographism is like a rare kind of a disease where you will find it out the dermatographism in most common type of a inducible or physical urticaria. So which occurring in approximately 2% to the 5% of the populations. So rarely it will be a seen in the populations. So we are having a one of the such a patient in our OPD. So I can able to present this case. The downward pressure on the skin, which will produces a linear erythematous wheal in the dermis in the shape of external force applied, earning the name of dermatographism, which means writing on the skin. Means whenever the persons who are having a dermatographism, whenever they will scratch or whenever they will have any kind of a pressure, they will have a deep marks of that particular pressure. So it is also called as a writing on the skin. So if the patient will write something over the skin, it will produces a typical mark of that thing. A small subset of the people with the dermatographism becomes symptomatic with a stinging, pricking sensation that can affect the patients.
Sorry to interrupt, ma'am. The slides are not moving, ma'am. Actually,
Okay. It will, I think it will take some time because of that thing. Can you able to see the screen?
now we can see the third slide, ma'am. Please continue, ma'am.
Okay, thank you. So in the dermatographism, the etiology, the causation, which is almost unknown. So exact causation of the dermatographism is not able to find it out. So, but probable etiology which has been proposed, that is a release of histamine from the mast cell, is thought to be play a role in cases of a dermatographism. Dermatographism has been seen in people like other comorbidities like diabetes, hyperthyroidism, hypothyroidism, menopausal, pregnancy, other medication related condition, but it can be also seen in a person who does not have any kind of a such a disease. So without a comorbidity, it can be a possible that the patient can have a dermatographism. The dermatographism is most common type of urticaria, frequently presenting in young adult with the peak incidence of the common type of urticaria, frequently presenting in the young adult with the peak incidence in second and third decades. So it is commonly seen in the ages of second and third decades. So 20s and 30s are more likely to have a dermatographism. There has not been shown a relationship between the race and dermatographism. So a dermatographism has a no role with the race. Also, one study shows that pediatric patients showed a female predominancy. So, in some research study, it has been seen that female patients have a more likely to have a dermatographism than the male patient. A hyper-eosinophilic syndrome is associated with an atopic children and increased dermatographism. So the children where you will find it out a hyper-eosinophilic syndrome is commonly having association, and these are associated with the atopic children and increase the number of eosinophils in the blood. One third of the
Ma'am,
patient.
sorry to interrupt, ma'am.
Okay.
Some echo sounds are coming, ma'am, actually from your side, I think.
Okay.
Yes, ma'am. Please continue, ma'am, now.
Okay. Okay. करो शुरू. Okay. So one third of patients who experience a traumatic life event. So this is something a wonderful. We, as a homeopath, we should know that thing. So whenever having any traumatic mental history or any life event which will be a traumatic, then you will find it out the dermatographism is the increase. So one third of patient who experience a traumatic life event along with the psychological comorbidities experiences a dermatographism. So the traumatic life or past history or mental history of the patient, which will be giving hint us for the selections of the homeopathic remedy. Furthermore, it will be seen in the stressful events like a pregnancy, like a menopausal condition, the incidence which will be seen in a higher condition. The symptomatic dermatographism are thought to be a generally idiopathic, but various explanations are given, but not exact explanation is there why it is occurring and how it is occurring. So pathophysiology of the dermatographism is no concluding mechanism explain why dermatographism occurs. Mechanical trauma, so any scratching, any pressure, or any such kind of a condition when there is an stressful events occurs in the physical condition, there the mechanical trauma activate a vasoactivate mediators which release from the mast cell, and then secondary to the antigen interaction with the bound AGE. So after any kind of a slightest trauma, which will release the vasoactive mediators, and because of that thing, the IgE is released. This is thought to cause an exaggerated biological response known as a triple response of the levies. Initially, the capillaries will become dilated and producing superficial erythematous phase. The next, an axon reflex flare and communication to sensory nerve fiber causes an expansion of the erythema secondary to the arterial dilation. So because of this dilation, arterial dilation, the linear wheel is formed through the fluid transfusion. So because of the arterial dilatations, the fluid which will comes out and which will produces a like a linear wheels, or there you will find it out a raised skin surfaces because of that thing. This entire response takes on average maximum up to 5 minutes. So it will occur or it will develop within the 5 minutes after the external stimulus stroking to the skin, but this definitely depends on the sensitivity of the skin. So if the sensitivity is more, then it may develop within the few seconds, and if it is a less sensitivity, then it will develop up to the 5 minutes. The will can persist anywhere from 15 to 30 minutes. So the raised skin or wheals which appears due to the stressor, which will remains for that up to the 50 to 30 minutes. So after the 50 to 30 minutes, it resolves by its own self. But whenever the same kind of causations, the stressor, the scratching, the pressure which applies, it will appears re-again. So that will be the something which is troublesome to the patient. The next thing, but we will find it out in a history and physical symptoms. So dermatographism, lesion which appears following a mechanical trauma to the skin. So whenever there will be a trauma, physical trauma, mechanical trauma, most consistently stroking of the skin. So whenever you will have any kind of a stroke, whenever you will have any mechanical trauma, whenever you will have a scratching, the dermatographism most likely to be developed. A wheal form and develop in approximately 5 to 10 minutes maximum. As we have discussed earlier, it persists for 15 to 30 minutes. The deeper the edema into the dermis, the larger the wheal appears. So how much the trauma will be there, or how much the scratching will be there, it will depends on the size of the wheals or size of the raised skin which will be appears. So that purely depend on the trauma. So how much size it will appears in the dermatographism. In systematic dermatographism, the pruritus accompanied with the wheals. So as it is an inflammatory process, it will also having a characteristic itchy. So that pruritus which will worsen at night, or any friction of the area from the external stimuli, heat, stress, emotion, and exercise. So any kind of external stimuli will be there, heat or mental stress or physical stress, even the emotions, disturbances in emotion and exercise. This will produce a dermatographism. Dermatographism most commonly involved in the trunk, extremities, and other parts of the bodies, but least likely to be developed in a genital areas, but it can be also present in the genital areas also. Now, what are the different subtypes of the dermatographism? So one is a dermatographism, second is a ray dermatographism. So in ray dermatographism, we will find it out a small punctured wheal predominantly on the trunk with the characteristic red dermatographism. So red appearance will be find it out in the red dermatographism. Follicular dermatographism, which will be a isolated urticarial papules. It is also a cholingeric dermatographism, which is you will find it out in a large erythematous line marked by the punctate wheel. Delayed dermatographism. So as we have seen in the earlier, it will develop within the 5 minutes. But in case of a delayed dermatographism, it will be a develops, or lesions will be developed in 3 to 8 hours after the initial injuries, and that may persist up to the 48 hours or 2 days. A cold precipitate, the exercise induced, and the familial. So with the family's history, it will be a scene. The management part, the prevention and avoidance of the precipitating factors. So identifying what are the things which will affect to the patient, or what are the precipitating factors. So identifying that and preventing that may help a patient to reduce such incidents. So prevention and avoidance of the precipitating factors such as physical stimuli and decreasing a stressor are important factors in controlling dermatographism. So this will help, or this stressor, when it will be having a prevention, then it can be a prevented. As a treatment part in a allopathic side, it will mostly giving a antihistamine drug like a cetirizine and all to have a to prevent such occurrences, but it will not help for the longer time. The eruptions, the raised skin, which will appear whenever there will be a precipitating factors will be there. So that will be the treatment and management part. Now, few differential diagnosis which will be a look very closer to the dermatographism. So first, dermatographism we have already seen. So a linear veil or urticaria after skin stroking or itching, that you will find it out. But the main thing from which you can differentiate is provoked by the mechanical pressure. So whenever there is a mechanical pressure trauma will be there, will find it out dermatographism. No systemic symptoms will be involved. So no other systems that get will involved. The next is the cholangitic urticaria. So there you will find it out the small wheals with the intense itching, which is triggered by heat, exercise, emotion. The differentiating feature that triggered by increased body temperature, not just a stroking or pressure. So dermatographism, that is due to the stroking trauma, but here it is not because of that thing, it is because of the heat. It is next is cold urticaria. So urticaria which will triggered by the cold exposure, either localized, either generalized. So ice cube test can be done. So whenever the extreme cold exposure will be there, and if you will find it out if you will find it out the urticaria, then it will be a positive sign for that. Or the next is a heat urticaria. So local wheel in response to heat. So when you will have a extreme of the heat exposure, then it will produces a urticaria. So that can be a differentiating with their causation. The pressure urticaria, especially delayed urticaria, so which will be also looks very similar to the dermatographism, where painful deep swelling hours after the sustainable pressures. So it will develop, or it will take a long time. So delayed reactions will be seen 4 to 6 hours after the any kind of a causation, but it will be a deeper than the typical dermatographism. So you will not find it out on the superficial level. The next thing, contact dermatitis. So erythema, vesicles or scaling in areas of the contacts. So whenever there will be any contact area, you will find it out the erythema, particularly on that part only. Differentiating features. So it will be, you will find it out a longer onset and definitely having a allergic reactions or any kind of allergic reactions or allergen which will be exposed, and there you will find it out the urticaria. Another which is very characteristic is the persistent mastocytosis, where you will find it out a persistent brownish macule, where you will find it out a Darrier sign which will be a positive. So the skin lesion persists, where you will also find it out a systemic involvement. So mainly the mastocytosis which have a affection to the bone marrow, affection to the liver, affection to the spleen, and because of that thing you will also find it out the eruption or raised skin. With that you will also find it out that systematic involvements, GIT involvement or other symptoms will be there along with this thing. Next thing is a scabies. So scabies, where you will find it out the same raised skin surfaces, but there will be an intense itching which will be a severely at night. But differentiating feature is that this itching is not mechanical or with the any kind of a mechanical causes, but it was due to the mites, scabies mites. So whenever you will have a taste of that, you will able to find it out some mites, scabies mites in that. So you can differentiate by that thing. The complication. So dermatographism has no direct any complications, but reoccurrence of the same complaint with any kind of a causation or stress factors or any kind of a mechanical trauma, it will redevelop. That will be the most bothering thing which affects to the patient. Now moving forward with our today's case presentation. So our case is about the successful management of chronic dermatographism in 23-year-old female using an individualized homeopathic medicine. This case was evaluated by using a case taking, totality of the symptoms, and the rapidization. Significant relief not only in the physical symptoms such as itching, erythema, but also it will help to get the emotional stability, which was observed only few months of the treatment after. So it will help the patient to relieve the physical complaint and also become a mental stable, to get some mental stability. This case highlights the role of individual homeopathy in dermatographism as well as helps in a emotional adaptability. So how homeopathy case taking helps us to help us to the patient to get the cure. So this is a patient of a 23-year-old female student reported to the outpatient department of Parul Institute of Homeopathy and Research Hospital on 17th March 2025 with the complaint of raised inflamed lines on the skin appearing after the scratching. These marks typically disappear within 30 minutes. She had undergone conventional treatment and did not experience any relief, which led her to start with the homeopathic treatment. The chief complaints: skin become itchy, raised on a light scratching since 1 year. So she has a chief complaint, that whenever there will be any kind of a light scratching, any kind of scratching on that will produce a skin which will be raised, and then you will find it out a slight itching. The complaint accompanied with the itching. Also after a few seconds only, she will develop a swelling and mild redness. So mild redness and scratching that you will mild redness and swelling you will find it out after the moments of the friction. 30 to 40 minutes after the friction, the symptoms get relieved. So mostly after 30 minutes, the symptoms which will be a disappear. But when patient have such a friction again or such a scratching again, she develops the same complaint. So whenever the causations occurs, the same symptoms will occurs. The onset will be insidious following emotional affection. So it will be develops slowly and following emotional affections. So whenever they are having an emotional affection or emotional disturbances, within the few days she will have this kind of a skin ailments. So red wheals on the arms, legs and back with the itching. So mostly the areas where you will find it out this kind of a thing is on a red wheel. The worse from the heat, complaints are worse from the heat, emotional affection, pressure, and after scratching. No relief from antihistamine. So as we have talked earlier, she has already taken a conventional medicine. She has tried for 1 hour, but gets no relief, and that's why she moved to the homeopathic treatment. The past history: there was a recurrent episodes of allergic rhinitis in childhood. So in the childhood, she has a allergic rhinitis history, no any major illness or chronic diseases. So there will be no episode of major any illness. The family history, where you will find it out, there is father is healthy, no major illness. The mother is having allergic asthma. The paternal grandfather, who are healthy when alive, had a natural death. Paternal grandfather, where you will have a healthy when alive and had a natural death, but maternal grandfather has a history of allergic asthma. Maternal grandmother is healthy when alive and had a natural death. So major family history, they are having a mother is having allergic asthma and their maternal grandfather is having asthma, allergic asthma. The gynecological history, the menstruation, which will be a regular, the duration is of 3 to 4 days, flows scanty, color dark red, sometimes pale and watery. Pain will be there in the abdomen. So mostly menstrual history was about to normal, not a major illness or difficulties will be there in the gynecological history. The personal history. The personal history, where we will find it out that appetite is normal, desire for salt, where we will find it out a 2 plus, desire for bitterness will be 1 plus. There is no specific aversion. Patient is thirsty. The perspiration is profuse on the whole body. but specifically on the face. The bowel is satisfactory, one time a day and night. A urination, which is also a normal urination, 6 to 10 times in a day and one time in a night. So which we will find it out as a normal. The sleep get disturbed due to the thoughts and anxiety. So we will see in the mental spheres and in the life space what kind of a thoughts, what kind of anxiety she will have. So she will have a disturbed sleep due to this thing. The dreams, there is nothing specific. Habits and addiction, there is no addiction. The patient was ambitherable. The modality, especially the mental modality, is aggravations by the emotional affections. The physical general symptoms. So in the general symptoms, this patient was a conscious and well oriented. The appearance of the patient, especially the person is patient, she is very thin, having average build with the proper nutrition. Height will be a 5 by 2 with the 52 kg of weight. No history of anemia, no history of the cyanosis, no history of a jaundice, or no edema was present at the time of the case taking. The skin, there is nothing specific. It was normal. The nail will be pinkish. Gait, nothing abnormal detected. In the limb adenopathy, that was not present at the time of the case taking. The blood pressure, which was normal at the time of the case taking, which is 120 by 82 mm of Hg. The pulse, the temperature, the respiration rate, everything is normal. It will be a pulse will be of 72 per minute, temperature will be 97.8 Fahrenheit, and respiration rate will be 18 per minute. Systemic examination, the CVS has a S1, S2 present without any murmur. Respiratory system, bilateral airway present, entry present without any abnormality. The CNS, the GIT, and the LS, everything you will find it out. Nothing abnormal detected. So nothing will be seen in a unusual or abnormal seen in a systemic examination. Now, a very important thing about our case is a life space. So we have already seen the few physical general symptoms of the patient. Now we will see the life space. So first thing is the patient lives with her father, her mother, and her younger sister. So they are a family of 3 people. The childhood history, she was emotionally very sensitive person, yet he is a very brilliant and intelligent student who consistently perform well in her academics. So is a brilliant student in academic, emotionally sensitive. Her interest extends beyond the study into various extracurricular activity. So she likes to sing the song, she likes the dancing. So having so many uh, various extracurricular activities she was interested, where she actively participated with the enthusiasm. She has had a close circle of good friends. So having a numerous good friends and enjoy the spending time playing with them. So she is having a good number of friends, and also she is sparing a good time. Her school performance was commendable, earning her good grades, regular praise from her parents, especially her father. So whenever I was inquired about the thing, so she was told that she was very closely to her father. So overall, she experiences a happy and fulfilling childhood. So in the childhood, she was a brilliant, she was a emotionally sensitive, she was attached with the friends and family, especially she was attached with the father, and father is very happy with her academics, with her co-curricular activities and everything. So life space in the childhood. Now life space in the adolescence and adulthood. After her completion of the 10th examination, she wanted or she liked to take a maths group, but was interested in becoming an engineer. However, due to the pressure of her father, she took a biology group instead. So that was the first thing where the patient gets affected. So without her wish, she has taken a B group, that is a biology group. After that, her academic performance began to deteriorate continuously because she does not want to go into the biology group, or she cannot able to focus, or she cannot able to perform well in the study. She was barely able to pass her board examination. So because of her lack of focus, lack of interest in the study, the student who are brilliant in academics in the initial life, now she can barely able to pass the 12th board examination. Because of her poor performances, her father scolded her severely. So her father is very happy because of her academic performances, but now to see her upgrade in such a degrade condition, her father was highly disappointed with her, and because of that thing, her father scolded her severely and stopped talking to her for the longer time. So, as we talked earlier, also, if she has a very close contact or very close relationship, share a very close relationship with the father. Now that first she will get the disappointment that her father is not talking with her, scolded her badly, said her a very bad words. So this will affect the patient. So his behavior deeply disappointed her, and because of that thing, whenever her mother and sister tries to talk with her, she would becomes very angry with them. So she would now, where she was a happy people having a very close friends, enjoying with the friends and family, now whenever the parents, especially the mother and sister, wants to talk with her, she becomes irritable, she becomes angry. So the stage which will be a differ from the healthier stage. Later, she preferred to stay alone in the her own room. So she does not like to meet with the people. She like to be closed in a she like to be stay alone. So she did not like meeting her friends and even interacting with the family members. So she does not like to be meet with any people, even with those people who are close to her previously. She developed a nervousness and anxiety after that. So after this disappointment, she develops a nervous and anxiety. She would start trembling whenever she had to meet someone or when someone approaches her. So whenever any incidents where she has to force to meet with someone, then she develops a trembling. After that, she took admission in the nursing college, but neither liked studying nor enjoying the company of the others. So although she has taken admission due to the wish of the parents in the nursing college, but she does not like a study. She can again not able to focus on the study. She does not like to be with people, including her college. She does not like her college, her classmate, the college environment. She does not like everything. After spending year in the college, after spending year in the college, she fell in love with her classmate. So after that, she was feel or all her mental symptoms, which will gradually decrease or disappear after they enter into the relationship. So after the relationship, she will have a feels good. Her mental symptoms cannot able to focus on the study or isolation. That will be a decrease or disappear, and they likes a company, likes a study. So within after that relationship, within a few months of the relationship, they separated due to the dispute between them. So because of some issue, he don't like to spend a time with her, and because of that thing, they have separated. Now after this disappointment, this is the second time disappointment. So first disappointment was a disappointment with the father. This is the second disappointment. This disappointment was with the love or with the relationship. So after this disappointment, she began to experience same mental symptom that she had previously. So all the symptoms, desire to be leave alone, or not able to focus or concentrate on the study, that all will again reappears. The nervousness, the anxiety, everything reappears again. But this time, she also developed hatred towards her ex-boyfriend. So she has developed a hatred feeling. However, since they were classmates, they had to see each other daily. So after separations also, due to they have to attend a college regularly, they daily see each other, and because of this thing, the main causation, the main thing of the separation, they daily have to face. So because of that thing, she gets affected so much, which made it difficult for her to move on. So again and again, she was having a same kind of a feeling, that disappointed feeling that will be felt every day whenever she will see see her ex-boyfriend. So which will made it difficult for her to move on from the breakup. She kept thinking about the separations. What will be the my fault? Was not look good? What was my behavior was not good? Likewise, she is thinking of she were thinking about the things. So because of this continuous thinking about the thing, she cannot able to move on. This constant emotional pain led to a deep resentment towards him. So she also developed a feeling of betrayal, as if he has played with his emotions, played with his feeling, and because of that thing, such an intrusive thought began to affect her sleep as well. So these thoughts will now begins to affect her sleep. So as we have talked in the physical symptoms also, the sleep is disturbed due to thoughts, that is this separation thought, this disappointment thoughts, and that will affect the sleep. A few months after the breakup, she started developing the physical complaint. So all the complaint what we have seen in the as a chief complaint will be developed after the few months of the breakup only. And that complaint was a raised skin eruption that appears after the scratching. So we have already seen in the initially also in the pathophysiology, any emotional trauma or any emotional life event where they are having a breakdown, you will find it out dermatographism likely to be developed. So that was the thing which we will find it out in the patient. Now, case processing. So already we have seen the differential diagnosis. So diagnosis was confirmed with the dermatographism. Now analysis and evaluation of the symptoms. So first thing that was taken is the mental symptoms. Elements from love, disappointment, that will be of 3 mark. Continuously thinking about past disagreeable memories. So again, a mental symptoms. Anger, talked indisposed. So whenever anyone wants to talk, there will be a irritability. So anger, talk, indisposed, that will be of 2+ grade. Company aversion, or like to be live alone, that will be also a 2+. Anxiety after emotional affection, but that was not such a marked and characteristic, but yes, it was there. So I have taken in a 1 mark. Hate person who hurts her. So whenever she thinks of him, she hatred that person, but more she is having a feeling that she is somewhere lacking. So that is the more basic idea. So have taken in a 1 grade. Emotional modalities. So emotional stress, which will aggravate the complaints, especially the emotional and physical complaints. The physical general, that is desire for salt, that will be a craving for salt, that will be a 2+. Craving for bitterness, that will be a 1+, which is not much mark, but salt is yes, definitely. The patient is thirsty, drinks large quantity of water. The perspiration, as we have seen earlier, the person on whole body, there is a profuse perspiration, but especially on the face. The thermals, the patient is ambithermal. Physical particular, where we will find it out, the skin which is raised on a light scratching, wearing watch or tight clothing. So any kind of a thing will aggravate the complaint. Emotional affection, that is ailments from red wheals on the arms, legs and back. So the raised skin will be found on the extremities or on the back with the itching. Also worse from the heat, emotional affection, pressure and after scratching. Swelling and mild redness, which will develop after the moment of the friction. So mainly the raised skin, itching, and swelling, which is a mild, and redness, which will be a mild after the aggravating factor, which is heat, emotional affection, pressure, and after scratching. Now the next thing, the rapidization. So the selection of technique to solve the case, it is a rapidorial approach. So after the rapidization and after the seeing the references of the materia medica, we have concluded the prescription. So first we will see the rapidization, which was done with the Zomeo software with the approach of JT-CAN. So these are the rapidorial totality: mind, love, disappointment, unhappy, elements from aggravation. Mind dwells event on past disagreeable things. Mind, irritability, spoken to when. Mind, company, aversion to. Perspiration, profuse. Stomach, thirsty. Skin, eruption, scratching after. Skin, eruption, urticaria, nettle rash, or scratching aggravation. Skin, eruptions, excitement, emotional aggravation. Skin, eruption, warmth, aggravation. Skin, eruption, itching. So these are the rapidization. As you all can able to see, the nitramure and the sulfur both covers good marks and having a cover a same number of rubrics, that is 10 rubrics, but nitramure covers the 34 marks while sulfur covers the 33 marks. So it is very difficult to choose any one remedy, either nitramure or either the sulfur. But by seeing the mental symptoms, which is more characteristic in this case and which is more predominantly seen in the nitramure rather than the sulfur. So love, disappointment, dwells on the past disagreeable sensations, company aversion to these rubrics, seeing after, I have selected the first remedy, that is a nitramure. So remedy selection was a nitramure. The nitramure remedy is selected on the basis of rapidization result and from different sources of the using a materia medica. Now justification of remedy. Physically, nitramure is next most effective medicines for the dermatographic urticaria. So it is one of the leading remedy for the dermatographic urticaria. This medicine is indicated when raised skin or bumps appears on the skin after scratching, which was present in our patient. The bumps may be quite large. Intense itching attended it. So with the itching, with the raised skin after the scratching, which was also present in our patient. Well indicated remedy for the indicated when exercise and heat exposure. So we don't have a exercise elements, but definitely we are having a heat exposure as a triggering factor for the urticaria. Person needing this remedy may also suffering from dermatitis or family history of any allergic history. So we are having also that thing in the maternal side. Mentally, the patient feels betrayed. So that is the marked symptoms of the nitramure, which was also present in our patient. So betrayal feeling, disappointed by person she trusts or love the most. So in our patients also we are finding out the same thing, where we will find it out the disappointment to the person with whom she trusts the most or she loves the most. That is her father first. That was the first disappointment. After that, her boyfriend. So there will be her two disappointment where she loved or she trusts the most. The nitramure patient usually have a history of disputes and quarrels with their parents. So same thing we are having with our patients also. There is a dispute with the fathers. Due to disappointment, patient becomes reserved. So as we have already seen in the life space, the patient was like to be with people, but after the affections, after the emotional disturbances, patient become reserved or develop aversion to company. She also develops dwells on the past event of the disagreements. So disagreeable moments she dwells on, and because of that thing, we have selected the nitramure. Our patient is also having the same thing. Also chronic grief or disappointment. So that is also present in our patient. After the disappointment, the patient will become angry and irritable whenever easily when spoken. So that was also present in our medicine. The mental symptoms and characteristic physical symptoms, which are very similar with our case and which is very characteristic and distinguished. So because of that thing, the age and the susceptibility, all thing we have taken into consideration, and after that we have selected a higher potency with the less repetitions. So we have selected first potency as a 200 C potency. So first prescription will be on 17th of March, where the Natramute 200 single dose has been given, followed by SL4 pills OD for the 15 days. The patient is advised to avoid the precipitating factors which can decrease the incidence of the dermatographism. The follow in the first follow-up after the 15 days, the 31st March 2025, the wheals which was reduced, the itching and redness which will decrease by the 20%, but no major change was found in the mental state, but sleep is also disturbed. But as the patient is improving, I have prescribed SL again for the 15 days. So SL 4 pills OD for the 15 days has been given. After 15 days, on the 14th April 2025, the intensity of the skin ailments and frequency of the skin ailments was reduced, itching reduced by 40%, mental state, now it will become more stable, can able to focus on the study. So still the medicine is acting. So again same SL has been given. So SL 4 pills OD for 15 days. After 15 days, on 28th April 2025, significant improvement in skin complaint sensitivity, which to the skin complaint was reduced by 80%. So improving stage, but emotionally disturbed due to thoughts and sleep still are not improving. Still get disturbed. So the mental condition which was stable previously, now it is disturbed. So it is again a time to repeat our remedy. So I have prescribed again Natramute 200 single dose followed by SL 4 pills OD for 15 days. On 19th of May 2025, there is occurrences was decreased. So rare wheals or raised skin appears only after deep scratching. So as we have seen in the chief complaint, after slight scratching, the skin complaint arises, but after the deep scratching only, she develops the complaint, rarely get affected by the past event, feels emotionally stable. So mental symptoms, physical symptoms improving. So again, SL has been given. So SL 4 pills OD 15 for the 15 days was given. Now next time on the June 9th, when patient came, there will be no episodes of the skin complaint, but sometimes disturbed by the thoughts of the disappointment, broken relationship. Still she has a sleep which was disturbed. So physical symptoms has been disappeared with the Natramute 200, but anyhow, the patient will be not becoming emotionally stable. So because of thinking of this thing, I have prescribed a one higher potency to remove this mental problems or these emotional disturbances. It is Natramure 1 single dose. After that, 15 days, on the 36th June 25th, not a single episode of the skin complaint, feeling of well-being, emotionally and mentally the patient is stable, no repetitive thoughts of past occurrences, and sleep is also sound. So the mental symptoms, the emotional symptoms, the physical symptoms, all the symptoms, she feels a completely relief. Also, she feels a well-being. So that may be the sign of the cure. Considering that thing, I have prescribed a simple SL 4 pills OD 15 days. Yet patient has not reported with any new complaints or the previous complaints. So now we'll see the few photographs of the patient where you can able to see the dermatographism. So first photograph which will shown after the only after the having any trauma or scratching, after the 1 minute you can able to see the first photograph, the complaint of the raised skin. On the next photo, second photo, you can able to see after the 4-5 minutes the development of the raised skin. So with the time it will be increasing in the size, so that you can able to see. Now the next, the video of the before and after we will see. So please see the video. So even in the 10 seconds, the patient will start developing the complaint of raised skin. You can see as 20 seconds has been already gone, and you can see or visibly changes can be identified in this 20-30 seconds only. And I have shared the photographs of the 1 minute and 5 minutes, so you can see how the intensified the skin was. That was the before the treatment video. Now I'll show you after the in the last follow which kind of the affection she was having. So she's a scratching, and as you can able to see, after the 10 seconds also, the patient is not having or developing any kind of a raised skin. So observing a patient for the next 10 minutes, 15 minutes also, no raised skin was appeared or any other skin ailments was appeared. Now, what are the different homeopathic remedy for the dermatographism? We have already talked about the nitramure in details. Now we will see the remaining or other remedies which will help to treat the dermatographism. So first, rustox, which is very prominent remedy for the dermatographism or treating the urticaria, which will be caused by the scratching, where you will find it out bumps or the skin which will be a red appears, which is a dark red color. So in the rustox, there is dark red color. Swelling which will appears around the skin. Violent itching is felt in the bump of the skin. So there will be a swelling, there will be a violent itching. Rubbing worsen the itching as well as the eruptions. So whenever the patient will rub the skin, there it will be a worsening the effect. So medicine also have a cold trigger urticaria. So whenever there is a cold trigger urticaria, the medicine is a effective remedy. The zincum mat, another medicine is a zincum mat. When you will find it out that this medicine is well indicated when wheal appears on the skin after scratching and rubbing of the skin. Though the wheal may occurs in any part of the body, but commonly we will find it out it will affect in the areas of thighs or back of the knees. So these are the main location where you can think for the zincum mat. Also itching and stinging sensation which will be felt in these eruptions. So with the itching, there you will find it out a stinging pain. The other remedy is a apis mellifica. So apis mellifica is also a great remedy for the urticaria, but which was a trigger by either heat or warm weather. Apis mellifica is indicated remedy where red will appears on the skin with intense burning and stinging pain. So as we all know, the characteristic symptom that is a burning and stinging pain, which was seen in this dermatographism. Itching is relieved when open air will be there or worse at night. So night aggravation and open air will be the amelioration. The next remedy is urticariurins. For the urticaria from the exercise, the medicine is a useful remedy. So after the exercise, whenever the patient will develop a dermatographism, it will be a very good remedy. Where you will find it out a red color raised bump will be there. Along with that, itching and burning. So itching and burning sensation will be the characteristic. Stinging pain or formication, which will be also a characteristic for the urticariurins. So itching, burning, stinging, and formication. The another characteristic remedy for the dermatographism is the Dulcamara. So Dulcamara is a remedy where urticaria triggered from the worm. So Dulcamara is helpful remedy when urticaria, you will find it out after exposure to warm atmosphere. So whenever there is a warm atmosphere will be there, the raised skins or wheals which will be appears on the skin. Along with that, a characteristic sensation, what you will find it out in a Dulcamara is a needle-like pricking sensation. So pricking sensation is a characteristic symptom. With that, itching and formications will be also seen in a Dulcamara. The other remedies are sepia, where you will find it out a cold air exposure as a triggering factor. So it will be a consider when there is a cold exposure will be there. Mostly affected areas are face, neck, forearm, and accompanied by the itching and burning. So the front part will be a more commonly seen face, neck, with the itching and burning. A stitching pain is felt in the wheels. Also, stitching type of pain will be seen in the sepia. Also better in a warm room. and all the mental symptoms of the sepia also we should consider whenever we will treat the dermatographism. For the conine, the the wheals or the skin ailments appears after the exercise. So when there is an itching and burning, or itching will worsen after the scratching, or painful skin ailments, then we can think for the conine. The next thing is the bryonia, when the pricking occurs in the wheel. So the characteristic bryonia pain is a pricking pain, which you will find it out in the bryonia. Medicine works very well when we will feel as if pain is like a sharp pin touching to the skin. So sharp pin like a pain you are having, then you can think for the bryonia. So this pricking skin will be the characteristic. Red elevated bumps appears on the skin, and itching is there with the urge to scratch. So due to the itching, there is desire for the scratching. So these are the few remedies. These are the references from the literature has been taken. And thank you everyone for listening so attentively.
Thank you, ma'am. Thank you so much for the overwhelming session. So, respected participants, if there are any doubts, kindly comment in the comment box. Madam will be answering. Yeah. So, I have a question, ma'am. Any other remedies which we can prepare for this dermatophytosis, ma'am?
We have already talked for the different remedies. So the sulfur will be the near one, as we have already seen in the repertorization for the dermatographism. Apis mellifica is also very indicated remedy. The one research has been already conducted for the dermatographism and has taken a good number of a sample, in which they have find it out the first remedy is the Apis mellifica, second was the sulfur, third was an atramure. So whatever the remedies I have covered in my presentation was the remedy which are having a very good impacts or very good results on the dermatographism. So these are the few remedies. Dalcamara we have seen. So these are the very good remedies for the dermatographism that we have already seen or we have already talked for with the characteristic symptoms of that particular remedies.
Thank you so much, ma'am. Any other questions from the participants? Hope they are clear with the topic, ma'am.
Okay.
So, thank you all. Thank you so much. So, there is an announcement. So, whoever want to submit their blogs and all, regarding to the any topic in the medical field, or else any articles which will be reflected to the AIHSAYA blogs, they can simply send the data to the address mail ID which I'll be commenting in the comment box. So to this mail ID you can send your data in the form of PDF Times New Roman format. So in which the content will be reflected in the AIHSAYA blog. So make use of this. So thank you, ma'am. Thank you all the participants for the extensive session. Looking forward for many more, ma'am. Yes, ma'am.
Sure. Thank you so much.
Thank you all.
Thank
Thank
you
you
so
so
much
much.
to the audience also for your attentive listening.
Thank you, ma'am. Yes, ma'am.